Harvey Walsh. Market access powered by big data. In December 2011, Vifor commissioned us to develop their market access strategy for Ferinject. Vifor had a market access team and their strategy at this time was secondary care focused. They worked in partnership with Fresenius, targeting renal departments and hematologists, as well as hospital pharmacists. They were not doing well, sales were flat, and there was a reluctance to use Ferinject as it was 80% more expensive than their competitors. What data did they have to support that strategy? The first thing we did was hold a market access strategy meeting with the key Vifor team, the marketing director, product manager, general manager, and market access director. Using our data from Axon, we mapped the patient pathways and identified the NHS drivers for anemia management. We presented our research and data to them, and to say they threw their toys out of the pram would be an understatement. They realized they'd been targeting the wrong customers with the wrong message. Our analysis showed that iron deficiency anemia is a major cause of emergency admissions into hospital, over 50,000 patients per year. The insights from our data were vital to the strategy we developed. We proved to Vifor that chronic anemia is not managed by hematologists, and the main management is actually done by gastroenterologists. We proposed a radically different market access strategy. Moving forward, their teams would be working mainly with payers in primary care, driving up the awareness of chronic anemia, and then developing commissioning pathways and services which would allow Ferinject to be used more often. We developed a number of tactics and tools to support this strategy. The team was equipped with Axon, our HES data tool. This allowed them to identify hotspots for anemia and target and stratify their accounts. It was crucial for Vifor to get Ferinject on every formulary. To speed this up, we developed and provided an online formulary submission tool. This tool is powered from our data and provides accurate numbers on the patients with anemia that are being managed. We also developed a service model. This model allowed Vifor to facilitate service evaluations within both the CCG and hospitals. They also had a tool which allowed them to demonstrate the profit potential of Ferinject. In primary care, they have a burden of disease model which they use with commissioners to highlight how much emergency admissions cost the CCGs. The aim is then to get the CCG to develop protocols for the earlier identification and management of anemia. Recently, the team have received a primary care service model which allows them to demonstrate and model the impact of shifting IV iron from the hospital setting to primary care setting. To support outcomes and provide evidence for Ferinject, we've developed a patient audit tool which allows hospital departments to evaluate the impact of Ferinject on individual patients and provide real-world evidence for continued use and commissioning. Our strategy certainly had an impact, and not all positive. Redundancies were made as they had too many market access people, but they expanded the CAM role. On a positive note, the strategy was correct and the program is a huge success. Ferinject sales are growing above target. 35 new formularies have been secured and the tools and tactics are really well received by the team. It's been a great market access program for us. Large revenue and happy clients.